I'm just going to go and share my screen. Amazing. So I'm happy to have you guys back here with us. We have over 200 people joining the call tonight, which is always just astounding to me how many people come in every time, every week for this English for Specific Purposes class. Tonight is extra special because we have a guest with us, Dr. Zach Alal, who's going to be joining at the final part of the presentation to bring his own experience and share with us. But before we get there, we're going to do a little English class where we're looking at linguistically English for specific purposes focused on mental health. So this is week 4 of a 4-week series that we are doing on ESP, or English for Specific Purposes. My name is Ariella Knight, and I will be your teacher today. I am founder and CEO of the American Institute, which is an English school and cultural exchange center in Algiers. And I am American. I'm from the Northeast, from Boston, and I've lived in the Southwest and in what we call the Mid-Atlantic. I'm trying to make it interesting for those who come every week. Class outline. This is an online class that is entirely free. We do it every Tuesday evening from 6:30 to 8 p.m. There are 10 sessions total. So this is our 4th week, meaning that we have 6 more classes after this. There are 500 spots in the group total, and I love when you guys interact with us on chat. And the sessions are recorded and posted on YouTube afterwards. This is our schedule. So we've already done 2 weeks on tourism English, and this is our 2nd week on English for health and medicine, although we specialized this course in English for mental health. And our remaining courses will be on media, social media, humor, beauty, cooking, and then a topic that you can help me decide. So quickly, a few notes before we start the class. So every week we will have a different topic, and we will mostly be focused on learning specialized vocabulary, okay? Sometimes we also have a relevant skill. We'll do skill development, and then we also feature guests. Okay, at specific points, I will ask you guys questions, and I want you either to join or answer in the chat or participate via mic. So for the chat, respond to exercises, encourage each other. I might not see everything, but I try to keep an eye on it. And then you can also submit questions in the Q&A. Just so you know, there is no certificate for this class. And the class is recorded and it's posted on the US Embassy YouTube and the American Institute YouTube page afterwards. Class rules. We need respect and civility in the chat and when you're invited to speak. Please be nice and kind to each other. We will not tolerate profanity, meaning swearing, or discussion of any irrelevant topics. And please join or please help create a fun and positive learning environment for everyone who's here. All good? Say my dogs that you guys see every week. These are not my actual dogs. These are internet dogs. Okay, so today's agenda, let's move right into it. So we do every week an overview of the class. We talk about ESP, the English for Specific Purposes. Now let's move straight into English for mental health. So we're going to first define what is mental health. Then we will discuss common symptoms and illnesses with some vocabulary. And lastly, we will do an interview with an Algerian doctor who works on mental health, Dr. Zach Alal. Ready for this? English for mental health, which is a serious topic, but we still love this very cute photo. So guys, this is where I want your interaction. Please share with me in the chat, write in your answers. What is mental health? If you had to define it, what does it mean, mental health? Oh, I love that. Soul health. Interesting. Okay, someone says taking a break. Someone else said mental health includes emotional, psychological, and social well-being. Very good. State of your brain. It's about your thinking, your emotions, your mental ability. Good. Your psychological state. Okay. Okay, very good. Emotions. I see a lot of common terms here. I see psychological, I see emotions, I see brain. A lot of people mentioning the brain. Very good. And then a lot of people mentioning what it means to have good mental health, meaning to feel good or to feel happy. Okay, someone else says mental health is how you manage your emotions, brain health. Okay, very good. So here's the definition we have. Mental health is everything related to emotional, psychological, and social well-being. And mental health disorders, which will be our focus today, can affect your behavior, perception, and thinking. Okay, so mental health is something that you guys are correct to point out the positives. When you have positive mental health, it has a good or positive impact on your emotions, your psychology, your overall well-being in life. And then we have disorders and the ways in which they can affect you. A quick note as we go into this topic. So this topic is very important and it can feel very sensitive. So I want to encourage you guys to share. I want to encourage you to contribute to the chat. But I also request, especially for this topic, that we remain very respectful. Anyone who is not respectful will be removed from the class. Okay, thank you so much in advance for supporting each other and discussing a somewhat difficult topic. So it's important to me when we're talking about English for medicine that we don't exclusively talk about physical health, because a big part of English or a big part of medicine is mental health. Okay, so this class will be about the language we use in English to reference or discuss mental health. So at times we might be talking about mental health disorders that maybe you know someone with that disorder or you suffer from that disorder, okay? So there might be some opportunities to share, and also there's an opportunity for everyone to learn about the language we use in English to talk about mental health. So this is my little quick note before we proceed. Next question. What are the main differences between mental and physical health? What are the main differences? I'm waiting. Okay, someone says physical is related to the body. Okay, someone else says symptoms. Someone says physical health, we can see it. It's visible. Okay, mental health concerns emotions. Mental health is related to psychological issues. Someone says you can see or you can feel the pain. Mental health is related to mood, to feelings. Mental health comes from the brain. Okay, very good. Mental health is related to physical health. Physical health is something you can see. Mental health is related to your heart. Mental health is about your soul, and physical health is about your body. Okay, one is about behavior, physical health, psyche versus body. Okay, very good. Okay, awesome, you guys. Thank you for those answers. I love those. I think most of them actually fit in the same way that we put things here. So we have first physical health. Physical health is the state of the body, which a lot of you also said. It is the literal physical state of your body. It includes internal and external cases. So I saw some of you saying physical health is visible. Not always. Sometimes you have symptoms, but something is happening inside your body. So it includes internal and external cases. Very important. Physical health problems can affect your mental health, or sometimes a physical problem can have mental health symptoms. Okay, you can have something that is physically wrong with your body, such as your hormone levels, and the symptom of that might be mental. Okay. Similarly, mental health is your state of mind. feelings, and emotion. So physical state of body, mental health is state of mind. However, mental health can also affect your physical health, and mental health can have physical health symptoms. Okay, so the opposite, what I told you before, your hormone level is low, that's a physical health concern, and you have a mental health symptom, maybe it's depression. The opposite could be true. Mental health could be the root of the problem. You're experiencing depression, and you can have a physical health symptom, which is that you become overweight because you aren't moving. Okay, so this question was a bit of a trick. I wanted to show you that while there are distinct differences between physical health and mental health, there's a lot of connectedness when you come to the symptoms. Okay, they're both related in terms of how you see them or how you might treat them. And I'll stop sharing there because I'm not a doctor, but this is what I know Zach is going to talk to us later today. They are related. Yes, very good. They are very related. Okay, so I want to hear from you guys. And I'm not sure, we said that people could join on microphone. Sometimes people don't have a good enough connection to share on the microphone. So we could try it. We could go in the chat. The question is, do you think mental health is as important as physical health? Why not? Okay, if you feel like joining on microphone, you can raise your hand and you can share with us your reason. I just ask that you be brief. Okay? Please, if you raise your hand, please make sure that you have a good internet connection. All right? I see lots of hands raised. Okay, I'm going to call here on Nabila. Nabila, you have your hand raised. I'm going to bring you to the stage. Please tell us, you can unmute yourself.
Hello?
And please tell us. Hi, Nabila,
Hello.
welcome.
Hi, how are you, Ariella? Hi, everyone.
I'm doing so well. Welcome to the stage.
Thank you. Thank you for this opportunity to speak more and to be. The subject is really interesting for me because I'm in the health field.
Okay. So what do you think about the question? Do you think mental health is as important?
I think mental health is, yes, of course. Both are connected. So mental health is as important as the physical health. Are you hearing me?
Thank you. We hear you, yes.
Okay. So both are important, and each one impacts on the others. So we cannot keep them away. They have both of them. They're really important.
Amazing. Thank you so much, Nabila. I completely agree. Thank you for coming up.
Thank you.
Okay. Bye-bye. Thanks, Nabila. So what I loved about what Nabila said is that you can't focus only on one. There's this connection, this relatedness. Okay, let's see who else wants to talk. How about Suad? Suad, I see your hand up here. I've brought you to the stage. Please unmute your microphone.
Hello, everybody.
Hi, Suad. How are you?
How are you? Fine, and you? Thank you for this opportunity to join you.
Thanks for joining us.
Yes, thank you. So I always say that all diseases are psychosomatic. So they are two components in every disease, soma and psycho. So both are related. So we have to treat the both to get to have good results on the patients. That's my idea. So we can do better when we act on the both of these components. Okay.
Amazing. Thank you so much, Suad. We have to treat body and mind.
Mm-hmm. Thank you.
All right. Thank you so much. Bye, Suad.
Bye.
All right, let's get one more. How about here we have Ines. Ines, come on up. You can unmute yourself.
Hello?
Hi, Ines. How are you?
Hi, how are you, Ariella? Are you fine?
I'm doing well, thank you. Welcome to the stage, as I keep saying.
Thank you so much. So I will repeat the question. Do you think mental health? Yes, the mental health is very important as physical health. Hello?
Okay. Yes, we hear
Okay.
you.
Okay. Why? Because the mental health it include the emotional and psychological of the person, and that's influence of the physical health. When we are good
Okay.
in our mental, we were also good in our physical health.
Okay.
That's all.
Okay.
Thank you.
Thank you, Ines. Very good. Thank you. I appreciate your opinion. Thank you so much.
Thank you so
Bye
much. Thank
bye.
you. Goodbye.
Yes, someone said in the chat, nice answer, and I agree. And then I know I said that was the last one, but you guys are being brief, which is great. It gives more time for another speaker. So let's do Lena. Lena, come on up. You can come and unmute yourself.
Hi. Hi,
Hi,
nice
Lena. How are you?
I'm
Of
good. How are
course.
you? Thank you
Doing
so
good.
much.
Doing good.
How are you? I will answer the following question. Yes, the mental health is important, like a physical health, because when someone feels depressed, they will be sick and can't speak or can't run or can do anything, because physical health is important, and we are like a machine, the brain is like a machine, the stomach is like a machine, so we have to uh, to to be happy, and the mental health is important, and we must focus about this, about the mental uh, is like important as a physics. Physics, we can how you say it, we can eat some food, we feel better, but mental health we can't. So that's it. I think we should respect our feelings and do our practice we like it, and that's it. And thank you so much to choose me. I appreciate it. Thank you.
Okay, you're welcome. Thank you. I liked Lena. You're starting to mention like treatment. You can't eat something necessarily to fix the mental health side
Yeah,
of things. Okay.
yeah.
Okay.
Thank you so much. Thank you.
Thank you, Lena. Okay. Bye bye.
Bye.
Oops. Sorry, Lena. I cut you off. Okay, you guys, this is really, I mean, these are great answers. If you've been in the past classes, we've had a really hard time with people having bad connections and not ready to speak. So I keep seeing your hands going up. So I think let's do one more. I keep saying one more, and then I go again. Let's do Bilal. Bilal, are you ready to speak? If you are, I put you on the stage and you need to just unmute your microphone. Okay, Bilal put his hand down, so I think he doesn't want to talk anymore, which is okay. Let's try Amin. Amin, are you there? Are you ready to speak?
Yes, I am here.
Hello, Amin. Welcome.
Thank you, Arina. How are you?
Doing well, thank you. Tell us, do you think mental health is as important as physical health?
Yes. I think mental health is important as physical health because
Okay.
The man or woman have a good job and nice family. Mental have mental health. Automatically
Okay.
is important for physical health. I think.
Okay. Okay. Very good. Thank you for sharing, Amin.
Thank you.
Okay. Bye-bye.
Bye bye.
Okay, and I mean, what I liked about what you shared there is that sometimes your conditions in life, like having a job or not, can be connected to your mental health. It's not always an exact scenario. It can be a lot of different things can lead to a good mental health condition. You guys are just like, these are such good contributions today. I'm so happy to have everyone participating. I'm sorry I can't call on you all, but the good news is that we have more. We have more opportunities to share soon. So let's keep going. I have now a poll. So we're going to go and launch the first poll. And the thing about the polls is they're anonymous. So I was hoping that you would feel comfortable sharing about your own mental health through an anonymous poll. Okay, so you should see it on your screens shortly. So go ahead, I'll give maybe about 30 seconds to go ahead and vote in the poll. The poll is, have you experienced mental health symptoms? Have you personally experienced mental health symptoms? All right. We'll do another 20 seconds. Okay. I'm going to put an end to it. Last moment to vote. 5, 4, 3, 2, 1. Okay, so you should be able to see the results. Can you see them yet? Yes? Okay, so almost half of you said that you have experienced mental health symptoms a few times in your lives. 20% of you said that you have experienced mental health symptoms many times or often. 20% said no, never. And about 13% said I'm not sure. Okay. So in this breakout, we have around, we'll say 70. So about 2/3 of people here have had some direct experience with mental health symptoms. Okay. All right, and we have one more. And thank you so much for sharing. I know it's an anonymous poll, but still, I know these can be kind of sensitive things to think about. Okay, now we're going to the next one. All right, you should see this one in front of you now, which is, have you known someone, a friend, a family member who has experienced mental health symptoms? So not you, but someone in your network who has experienced mental health symptoms. Okay. I see some of you saying, what are mental health symptoms? We're going to go through all of them. But I wanted to start us off just by even thinking if we even know about mental health symptoms, who in our community or in ourselves, if we've experienced those, just to get us in the right mindset. Okay. All right, 10 more seconds to vote. If you haven't voted yet, now is the time. Okay, we'll do 5, 4, 3, 2, 1. I know that wasn't even. Okay, so this is quite different. We actually have 82% of you have known someone who has experienced mental health symptoms. 9% of you have not known someone who's experienced mental health symptoms. And 9% said, I'm not sure. Okay, which with mental health is normal, that you really might not be sure if what you've witnessed was mental health. Okay, very good. Thank you. These are the results that I just read out. So we have 82%, 9%, and 9%. Okay. All right, we are going to go back now to the presentation. Can you guys still see it? Maybe? Yes? Okay, good. So let's get moving. We've got about 30 minutes now until Zach comes on with interview. So now we're going to jump into vocabulary. So before we start talking about mental health disorders, I wanted to tell you the meaning of the word disorder. So a disorder is an illness or a set of problems that disrupts your normal physical or mental function. So when we talk about a mental health disorder or a type of disorder, this is what we're talking about, an illness or something that disrupts our normal function. So common mental health disorders, symptoms. So first we're going to talk about the symptoms. The symptoms is what we witness someone doing. Okay, we don't witness depression, we witness someone sitting on a couch. Okay, this is the symptom. Common symptoms include major changes in eating habits, includes extreme mood changes, very happy, very sad, and then back to happy. The inability to cope with stress or daily problems, something that is not a big deal can be way too big for someone to deal with. Difficulty sleeping, addiction, and tiredness. Okay, all of these can be symptoms of a variety of mental disorders, but this is just the most common symptoms. Okay. So before we go into the list of disorders, I wanted to know, can you guys name any already? I know I've mentioned depression. Do you know any other mental health disorders? I see anxiety, OCD, bipolar, PTSD, anxiety, bipolar, schizophrenia, anxiety, OCD, anorexia, phobias, overthinking. I see people writing. Depression, nervous breakdowns. I see some symptoms. I see, or not symptoms, but I saw loneliness, psychosis, depression, stress. I see people putting autism in the chat. I think it's something we could ask Zach about of the where we put autism in this physical health, mental health spectrum. I see split personality. Okay. All right, you guys already know a lot of these. We are going to talk about disorders in categories. I believe we have 4. If I'm not mistaken, we have 4 categories of disorders. So the first one, these are called anxiety disorders. These are disorders that make a person feel uneasy, afraid, or worry about certain objects or situations. This includes social anxiety disorder, where you're really uncomfortable in social settings. Okay, this would also include OCD, obsessive compulsive disorder. Okay, these are anxiety disorders. Next, we have mood disorders. Okay, mood disorders disturb the person's mood. People with mood disorders might have fluctuations between extreme joy and extreme sadness. This is where you have bipolar disorder. This is where you have depression, okay? And then we have psychotic disorders. So psychotic disorders are characterized by distorted awareness and thinking. People diagnosed with psychotic disorders have difficulties determining what is real and what is not real. Okay, in psychotic disorders, we're talking about schizophrenia, among others. And then we have eating disorders. So eating disorders are those that disorders that can be defined as having abnormal eating behaviors that negatively affect a person's physical or mental health. This is one of the ones that is directly connected to that question of mental health disorder with physical symptoms. In this category, we have anorexia, bulimia, and binge eating. And then, maybe we have 5 categories. We have personality disorders. So personality disorders are defined by experiences and behaviors that deviate from social norms and expectations. So we have borderline personality disorder. I saw some of you mention this. We have narcissistic personality disorder. We have some antisocial disorders. Those are the 5 we have, okay? So that's anxiety disorder, mood disorder, psychotic disorder, eating disorder, and personality disorder, okay? Was there anyone in there that was new for you guys? Did you learn anyone that was new, or you think you know all of these? You knew all of these already? I think most of them you mentioned in your chat, in our chat, I should say. Not new, not new. It's known. Okay, this makes me, okay, some of them are new. Someone says, is addiction to something a mental problem? Addiction disorders, I think, are usually considered mental disorders. Okay, people are familiar. I honestly, it makes me really happy to see how familiar this group is with these disorders, because I think it's so important to know about them so that you can help either yourself or someone close to you experiencing symptoms, because sometimes these are less commonly known. Okay. Okay, you guys, new question that I want your feedback on. I want to know, what is the difference between a therapist and a psychiatrist? What is the difference between a therapist and a psychiatrist? Okay, Latifa says the second one is a doctor. Sarah says therapists are not allowed to give meds. Abdurrahim says psychiatrists give drugs. Okay, a therapist is a psychologist. I don't know. One gives medicine and the other just talks. One uses medical methods. One is a doctor and they can give medicine. Okay. Someone said one of those is mom. I think they're probably saying their mom is their therapist. Okay, Lena's giving us a good definition here. Therapist is a licensed counselor or psychologist who can use talk therapy, whereas a psychiatrist is a medical doctor who can diagnose and prescribe treatment. Okay, I think you guys know this. So we have psychiatrists, which has, we have therapists. So as you guys said, a therapist talks to patients to help treat mental health symptoms and manage the improve the management of stress and of relationships, really trying to help your quality of life. Therapists, as you said, cannot write prescriptions, okay? They are not able to prescribe you medication. Whereas a psychiatrist, these are medical doctors who diagnose and treat mental disorders. So you'll notice that they have the ability to clinically diagnose you. So if you need a diagnosis for something, maybe your therapist can guess, but they will refer you to a psychiatrist for an official diagnosis. Okay? Psychiatrists can also write prescriptions. The difference is also in terms of studying. So a psychiatrist studies for the full medical training and is a full doctor to get the degree. A therapist has less training and does not have the word, the little doctor at the beginning of their name. And truly the purpose of them is different. As you guys mentioned, the psychiatrist is there as a clinician, someone who brings a medical degree and level of knowledge and can get you medication. Therapist is there, whether or not you have a disorder, a therapist is there to help you manage your life, manage your stress, manage your relationships. Many people go to therapists without mental health disorder, but simply in need of support and guidance to move through difficult periods of their lives. Bonus question, what is a prescription? And don't give me the translation. Please describe to me prescription. Although the group tonight, you guys are pretty advanced. I would have to say I'm impressed with, you seem to know all these definitions already, which is amazing and gives us more time for conversation at the end. So this should be easy for you, my advanced group. What is prescription? Someone says it's the list of drugs the doctor gives you, giving drugs, list of medical drugs. I wouldn't use the word list. The cure for your sickness, that's close. The prescription is the treatment. Yes, kind of, okay. But it's not just treatment, it's medicine. Good, I'm seeing medicine. An instruction, writing medical drugs, medication, delivering drugs. Someone said doctor's order. Okay. Prescribed medicine you get from the pharmacy. Okay. It's a bunch of medications. Oh, and someone says it's instructions given to patients. I like that also. So essentially, the reason I wouldn't say list is because it can just be the name of one drug. It is the document or the medical order for treatment. And usually it is the name of a medication the doctor wants you to take, and the prescription authorizes the release of that medication. Okay, so you take the prescription, you go to the pharmacy, it allows them to give you the medicine. I know you all know how to say this in French, and I'm describing something to you that you know, but I wanted to find a way to do it without simply saying the direct translation. Okay? So now we're going to do some other terms. We have some mental health terms, and this is a bit of a vocabulary game. We have 4 words: sanity, addiction, obsessive, and breakdown. And we have 4 definitions. Okay? I want you to match the word to the definition. And don't put it in the chat. Don't put it in the chat. Do it in your head. Just think calmly. Don't panic. We'll come to them later, but if you put it in the chat, you might give it away for everybody. All right? Take some time, read through it, and tell me what they are. I see my instructions to not put it in the chat have been completely ignored. Ugh. You know, I always try. It never works, but I always try. All right, yalla, let's just go ahead. Number 1, sanity. What is sanity? What letter? A, very good. 1A, good. The ability to think and behave in a normal and rational manner. Good. What is number 2? Addiction, the definition of addiction. Okay, see, this one was hard between addiction and obsessive, okay, because I saw some people putting B and some people putting D. Well, addiction is actually D because it is a harmful habit of the use of a substance or a harmful behavior or activity, okay? It's interesting. I see why you might say B, because addiction is also someone who can't stop doing a thing or behaving in a particular way. I understand that, but we're actually looking here about the use of a substance. For it to be about addiction, it needs to be addiction either to something or to some action. Okay, this is why we use the phrase a harmful habit. Okay, good. Obsessive. That means obsessive must be B, right? There we go. Someone who cannot stop doing a particular thing or behaving in a particular way. And that means breakdown is C, a sudden collapse in someone's mental health. Okay, when we say there's a car broken down on the highway, we mean the car has completely stopped functioning. When we use it for ourselves, I'm having a breakdown, it means me. I have completely stopped functioning. So we use this both for machinery and for ourselves as humans to describe when we have reached a point and khalas, we cannot function anymore. Okay, sometimes I love the phrase in Algerian Arabic, rani lihna, because I love this description. I'm filled all the way up to here. And if you move me past, it's done. I have my breakdown. Okay, you guys. Next, you guys, I know some Arabic. Everyone's always so shocked in the chat when I say anything. It is an English class, so I only say, you know, vraiment chouïa, but I can say some things. Okay, 4 new terms. We have disability, we have trauma, we have self-conscious, and we have deficit. And please, let's not put it in the chat. I say with very low expectations. Thanks, you guys, for your nice comments on my Arabic. Thank you, thank you. my gosh, and nobody put it in the chat. Wow. Okay, and as soon as I said that, everybody started putting them in the chat. Okay, well, let's get going because we're pushing up here to welcoming Zach. So let's have, hold on a second. Hold on. Okay. Disability, number one, disability. What do we have for disability? We have D, a condition that limits a person's ability to engage in tasks or activities. Bonus question, are all disabilities visible? No, there are many disabilities that are not visible, okay? This is why the definition is not something that you can see or about a wheelchair or about a cane, okay? It just is any condition that limits your ability to engage in tasks, okay? Number two, please, trauma. C, very good, 2C. So trauma we have here defined as a distressing event or experience that can have an impact on a person's ability to cope or function. Good. Number three, please, self-conscious. Self-conscious. A, very good. Being worried about what people think about you or your actions. And these are not all, you know, mental health disorder terms. These are mental health general terms that we have all felt at one time or another. Okay, and the last one is deficit. B, deficiency in amount or quality. So we might use these terms when we're talking about mental health, having a deficit, especially when we're talking about hormone levels, about thyroid function. We might talk about, you know, a deficit of a certain physical function that can relate to mental health behavior. All right, you guys, and then I have some idioms for you. So we have one which is feeling blue. Do you guys know what this means, feeling blue? Feeling sad, feeling low. We say feeling down, depressed. Yeah. It's not nervous, it's not angry, it's just sad. Good. Spaced out. What does it mean to be spaced out? This is going to be harder to describe, I think. Lost focus, that's pretty good. Okay. Zoned out. Okay. I see some people saying feeling unworthy, thinking unable to do anything, distracted. Yeah, I think the best definitions I've seen so far are zoned out, or not, or maybe unaware. Like to be spaced out is like you're sort of looking far away. Someone's talking and you're not listening. Your brain is somewhere else. Okay, and it can happen to people experiencing certain mental health disorders. It can also happen to people who tend to be spacey, as we say, as the adjective. Some people tend to be spacey. It does not necessarily mean anxious or sad or in despair. It can be a symptom, or it can mean something really negative, but it does not have to mean something negative. It can simply mean you are staring in the distance, not listening to people around you. So it can be negative or it can be neutral. Okay. Down in the dumps. What does this mean? Down in the dumps. Yeah, people are saying, dumps? Down in the dumps, depressed, bad mood, sad. Yeah, down in the dumps is really, really feeling sad and depressed. I would say feeling blue is here, down in the dumps is lower. Yeah, I like someone said, yes, Mina says, without emotional energy. That's a little bit what it feels like. Like you can't even, it's hard to get out of bed in the morning. That's down in the dumps. Okay, good. And then shaken up. What about shaken up? Okay, frightened, stressed. Okay, nervous, scared. It's hard to find the right synonym in English for this because we have a good word for it in French, but I don't want that. Full of negative energy, not comfortable, upset, shocked. Okay, stressed. I see some people asking if they can come and speak. It's possible. We'll see if if we finish up with enough time to bring you guys back on microphone. So yeah, so shaken up would be, I would pick 3 words. I don't actually think anyone said this, but I would say agitated. Okay. And frightened and shocked. These are the 3 words that I would pick for shaken up. Agitated, so you're full of agitation. Frightened, usually when you're shaken up, something has just scared you, or shocked, or it has shocked you. So you're in a state of having very nervous energy. Okay. Yeah, with extreme emotions. Yes, you have, when you're shaken up, you have extreme emotions. If someone tries to rob you or does rob you and comes and grabs your purse and runs away, you're going to be left like, oh my God. How, it's, the event isn't still happening, but you are in a state of really high emotional energy and you have to find a way to bring it down. Okay. Usually you're not startled because the event already happened. It's the state after the event where you have to deal with the emotions of it.
I've seen a lot of change, been through a lot of pain. Some things are not the same as they were a year ago, but all will be okay. I move on each and every day.